I'm Dr. Arnold Weil, and I practice in Atlanta, Georgia. And my practice is a non-surgical orthopedic practice, and we also specialize in pain management. Acute pain is pain that's usually a result of an acute event with some damage to the tissue, and it's usually self-limited, and over a period of time the acute pain will go away with proper treatment. Chronic pain can be pain that patients describe as hurting all over or all over their back. It can be continuous or it can be intermittent. There are a limited number of causes or pain generators, so to speak. And I like to just break these down into whether it's in the intervertebral disc, is the pain originating from the muscles or soft tissue, is it more of a bone or joint problem, or is the pain inflammatory or strictly affecting the nervous system. 42% of women, you really develop pain just from shoes that probably don't fit well or not the best shoes to be wearing around on a regular basis. So the foot should really fit very well against the bottom of the shoe. Also, sometimes we use pads, different pads to help absorb some of the shock and cushion the foot as well. Sometimes just wearing the shoes can cause cramping and pain in the foot, so we always like to recommend, stretching, some good exercises to try to alleviate some of that pain and some of that stress. The soft tissue injuries are very common in motor vehicle accidents. There typically is a lot of pain associated with them. And often the pain just from the soft tissue injuries to the neck can certainly overpower any pain from the facial fractures. So again, you have to really be astute enough to recognize, what component is the fracture, what component is truly soft tissue injuries, how these may even not occur simultaneously. I mean, you'll have the facial fractures and injuries that immediately following the motor vehicle accident, and maybe 2 days later the soft tissue component, the muscle spasm, the sprain and strain, then will begin to occur and it will present itself also.
It's not just athletes that get injured, and you're absolutely correct, because I see a lot of patients coming in from everyday types of activities that have injuries. Not blooper-worthy injuries, of course, but sprains and strains. And, typically I would tell you to maybe rest and use ice or heat and take an anti-inflammatory, but a lot of people just ignore the injury. So the first thing you should do if your pain persists is call your doctor. And anti-inflammatory usually is a pill form, but I've been using recently a newer type of anti-inflammatory called a Flector patch. It comes in a patch. It's a topical patch. You apply it where the pain is. The medicine goes right through the skin, and it's incredible. I've had patients that come back. They've recovered faster. They've been able to return back to their normal activities.
A lot of times I'll inject the SI joint around that joint in the office, and they'll come back and say, I feel a lot better, the pain's better, it's almost gone. So it's a pretty good yield injection. Typically, if we do a trigger point injection, we'll follow it up with some local heat for about 3 or 4 days, and then with some stretching, and then some strengthening exercise, start strengthening those structures that have become inflamed and have become painful and tender. We put a corticosteroid, very potent anti-inflammatory agent, into that joint space to reduce the inflammation, reduce the pain, kind of restore mobility, to allow us to really take the patient to the next level as far as treatment.